title of this talk is Sleeping with PTSD. I've already made some tapes on helping you relax in order to fall asleep, but I want to give you a talk about sleep that I hope you can understand to an extent that will improve the way you spend the night. First of all, we want to make sure you don't have a condition that's keeping you from having refreshing sleep. The most common condition that soldiers return with from combat that interferes with sleep is sleep apnea. Now, this is what I want you to do, because it's hard if you're sleeping alone, but if you have someone who sleeps nearby you, ask them if you snore. If you're snoring very loudly, ask them if they notice any time that you seem to stop breathing, even for a moment. That stopping breathing is the word that means apnea. Now, the other things we want to look for would be feeling very tired during the daytime, so tired that you might even fall asleep in a chair in the waiting room waiting to be seen. Also, you may have a very dry mouth when you wake up at night. You may have a large neck size, like a dress shirt that's 17 or 18. Those things, snoring, stopping breathing for a moment, a dry mouth, being very tired in the daytime, and feeling that you're just as tired when you wake up as when you went to sleep, and having a sense of fatigue all the time. These are things we're looking for, especially with a person who has a large neck. It can happen to anybody, though, and it tends to run in families. We don't know why we're seeing so many soldiers coming back from combat with sleep apnea, but it's a very real problem. If you have it, or you think you have it, talk to your provider about this, because that needs to be treated before we can help you have refreshing sleep. If you have sleep apnea, it limits the kinds of medications we can use to help you fall asleep and stay asleep. The ideal way to sleep is to have a place where you can rest at night, where it's quiet and cool, and where you may have to have a noisemaker like white noise or music. What you don't want to have is light from a television set, from a computer, from the bathroom. You want it as dark as possible. We also want you to have a sense of safety where you sleep. Many soldiers tell me they're afraid to go to sleep at night because they're afraid of the disturbing nightmares. But I think they're also afraid of being attacked, being vulnerable, being unable to protect themselves. A lot of our soldiers sleep with weapons in the bed or weapons nearby. There are obviously some dangers connected to this. It's not going to be the weapon that saves you or gives you a good night's sleep. It's going to be the habit of good sleep hygiene. And I'm going to talk to you about that now in a few minutes. So have a quiet place, a cool place, and have a sense of safety that you're able to let yourself fall asleep. Now, there are some disturbing things that happen with a lot of people who have come back from combat. And that is, the dreams may seem very, very real, as if you are right back in combat again. The best way to deal with these dreams, sometimes called nightmares, is to talk to your provider about them and to write it out on a sheet of paper and bring the dream to your session so it can be discussed. And we're going to find out that if you write the ending to the dream that you would like to have, a very pleasant outcome to that bad dream, over time, if you read this, say 3 times a day out loud, for many soldiers, the ending of this nightmare will become a pleasant ending for you. Don't be afraid of having nightmares. In some cases, they're a good sign. It shows that you're getting close to resolving a conflict that has to do with some unfinished business from combat. One other thing about sleep apnea is it tends to run in families. If you have a mother or father who snores loudly, they may have sleep apnea even without the diagnosis, and that puts you at risk of having sleep apnea as well. What to do when you have a bad dream? I've already made an audio tape for you to listen to help talk you down from the bad dream. We don't want the bad dream to keep you awake very long. Once you wake up and listen to the tape, we want you to fall back to sleep. We've also made an audio tape, a CD, for you to listen to help you relax enough to fall asleep. Sleep is very important. Sometimes we use medications. we have some very powerful medications that have many side effects. We want you to have only a short-term use of those medicines. One of the most powerful medications we use for sleep is called Seroquel, S-C-R-O-Q-U-E-L. That's okay to take for a while. We don't want you on that for a long time because it has many unpleasant and possibly lasting side effects. If you have sleep apnea, we very often try Ambien to help you fall asleep. But the Ambien must be taken as soon as you go to bed. Don't get up. Give it a chance to help you fall asleep. So often we've used a medication called trazodone. The trazodone may not be helpful if you have sleep apnea. In fact, it may be working the other way. So it's important to rule out sleep apnea first. Now let's talk about the stages of sleep, because this is very important. So many soldiers tell me that they have to drink a 6-pack of beer in order to fall asleep. They're not falling asleep, they're falling into anesthesia. They could actually have minor surgery without waking up because of the alcohol. The alcohol destroys the normal stages of sleep. Normally sleep goes from very light to very deep, and it takes about an hour and a half to go from stage 1, which is the lightest stage of sleep, to stage 4, which is the deepest stage. And for the normal person, after stage 4, there is paradoxical sleep, where the person slightly wakes up and begins dreaming. We call this REM sleep, or rapid eye movement sleep, because the person who's dreaming will be moving their eyes under their closed eyelids randomly. They can be moving from side to side or up and down. This is a strong indication that they're dreaming. And after the dream is ended, they go back into stage 1 or light sleep and repeat those stages all through the night. As you sleep, the REM stage gets longer. So the REM stage you have just before you wake up in the morning is the one that you're going to be remembering most during the day. I keep a dream journal, and I encourage you to keep a dream journal. Write down your dreams, not just the bad dreams, but any dreams you have, and bring those to therapy. I think of the dream as a psychological biopsy. It's a little piece of what's going on in your mind, and you can tell a whole lot about what's going on in your mind by having someone you trust discuss the meaning of the dream, the interpretation of the dream with you. If you're waking up just as tired as when you went to bed, if you're getting up all during the night to check the windows and the doors, if you're sleeping with a gun, having a weapon nearby, if you're feeling totally ill at ease, especially at nighttime, then we need to talk about this in a way that can help you overcome it. Because in order to have a normal, healthy, flourishing life, you need restorative sleep. I believe that one of the reasons many soldiers are so angry and easily upset is because they live in a state of sleep deprivation. Sleep deprivation, or the lack of normal amount of sleep, is just as powerful in terms of having bad effects as a 6-pack of beer. The effect on driving in a deprived sleep state is the same as driving under the influence of alcohol. It's dangerous. And so people go around all day long, short-tempered, angry, and sleepy, and they're not able to listen or think or pay attention. Their memory becomes shot. So it's very important to find a way to sleep peacefully. There are many antidepressant medications we use, again, for short periods of time to help people fall asleep and stay asleep. One of the first objectives with your health care provider is to be very open and honest about how you spend the night. How you spend the night is determined largely also by how you live the day. Try to keep your stress levels down to a minimum if it's possible in the daytime. Some people find that music relaxes them. Try to find something that's relaxing. Music, movies, reading, exercise, fishing. I'm impressed with the large number of soldiers who tell me the only time they can relax is when they're fishing. I encourage you to find a hobby because that will reduce your stress. When you have the stress levels reduced, you're more likely to have a good night's sleep. So let me summarize this discussion. Sleep is important to your health. One of the most common reasons that many soldiers are not sleeping well is because of sleep apnea. We can only tell if you have sleep apnea by having you spend a night in a sleep lab. In order to be referred to a sleep lab, you're likely to have loud snoring that's interrupted by stopping breathing, a dry mouth when you wake up during the night, a large neck, and feeling very, very tired during the daytime. Remarkable daytime drowsiness. I've seen soldiers who are so sleep deprived that they fall asleep at a traffic light, waiting for the light to change, only to be awakened by people blowing their horns behind them. So I cannot overemphasize the importance of getting a good night's sleep. We want to help you in any way we can. It's going to depend a lot on your willingness to cooperate, to give up alcohol at nighttime, to have a peaceful, quiet place to sleep. One of the things that I want to mention to you is that during the REM time, the voluntary muscles are paralyzed. If you happen to wake up during REM time, you will be frightened because you won't be able to move until you actually wake up fully. There is an unusual behavior, a fairly new condition called REM behavioral disorder. And instead of your muscles being paralyzed, you may get up and act out your dream, including striking the person next to you in bed or doing things that you don't remember the next day. This is called REM behavioral disorder, and we can treat it effectively with medications that decrease the amount of REM time you have during the night. REM is important, but some people have too much REM time, and we can control that. We want you to have a good night's sleep, and to do that you have to have a good day. To have a good day, you have to put your priorities in order. We want you to be thinking about how to improve your relationships, how to take care of your body, mind, and your spirit, and how to be a good soldier as well as a good father and husband and a good friend. Let me encourage you to work on improving your sleep and to keep a dream journal, even if it's about nightmares, and to bring that in so we can talk about it. If you have any questions, bring it up in individual sessions or in group therapy. Good luck, my friends.